Hello, this is Trevor Halsauer from Valley Vital Medicine. I'm a nurse practitioner here in Fargo, North Dakota, and today I am doing a review of the Onconomics Plus test by RGCC. We are super excited here at the clinic to be able to offer this suite of testing that RGCC has because I think that it's really going to be a complete game changer for the clients that we have that are struggling with cancer and trying to figure out what they can do to improve their treatment response. So first, we do want to offer this disclaimer. Anything that we are talking about today is educational and informational only, and it's to be used just as a self-help tool for your own use. We are not providing medical, psychological, nutritional therapy advice because you're watching this. This does not mean you are a patient of ours. So if you are a client of ours, for sure, reach out and we'll have a deeper discussion as to whether this information is right for you. So what's Onconomics Plus? Onconomics Plus is RGCC's most comprehensive diagnostic tool for personalized cancer treatment. It utilizes CTCs or cancer tumor cells, which are isolated from the blood to assess how the cancer will respond to a wide range of therapies, which is really cool. So what is the purpose of this test? It is to determine the effectiveness of specific treatment options for a person's unique cancer cells, allowing for a more personalized and targeted treatment plan, which is typically performed after the initial diagnosis is made. So, what I really like about this is the fact that up until now, we have a lot of really cool tools. We have a lot of really great knowledge. There's a lot of studies out there that talk about the different types of things that have shown benefit in general in studies that have anti-cancer properties. But the hard thing is that that list of things can get to be really, really big. Now, what we're trying to do is we're trying to narrow that window as far as not just saying things are good for cancer, but ultimately these things are good for your cancer. And so that really is the goal of what this test is trying to accomplish. Okay. So what types of information is provided? So treatment response analysis. So this test, what they do is they take those cancer tumor cells and they test them directly for different types of therapies. So actually over 90 different chemotherapeutic agents, targeted therapies on a patient's specific cancer cells. So they also look at natural substance effectiveness. So of over 50 natural compounds, extracts, and different vitamins. It also looks at the genetics and the physiological profile of those cancer tumor cells to determine the makeup of them and whether that expression may indicate resistance to certain treatments as well. And then it also does give us a circulating tumor cell count, which is similar to the OncoTrace test, but yet it's done in a little bit different way. So it's not focused as much on that, but it does give us information that corresponds. So RGCC stands for the Research Genetic Cancer Center and offers a range of cancer-related molecular cellular assays, or also known as tests. So one of their main tests is the Onconomics Plus, and they describe it as their most comprehensive panel, and I agree. So it combines two different sub-panels. So one is the Onconomics. So the Onconomics is the testing of the sensitivity, the resistance of cancer cells, specifically to chemotherapeutics and other targeted therapies that maybe you would think about on the conventional medicine side, which would also include immunotherapies. Now, they do have the Onconomics extracts or the Extracts Plus, which tests the natural substances or plant extracts for potential anti-cancer therapies. And so we can also use this along with their genetic profiling, but we also can ask for specific things. So if somebody has a specific substance that they are wondering is going to be effective for their cancer, we can actually add on some of those things. And if there's a particular substance that we want to send to the lab to test, we actually can include that in the package, send it with, and then they will actually test those cells against that particular type of therapy or nutrient. So the Onconomics Plus, really the goal is to give us a three-in-one type of profile. So number one, how many circulating tumor cells are present? Number two, what is the gene expression in the epigenetic profile, um, or for those specific circulating tumor cells? And then also the chemosensitivity and the viability response of somebody's cancer when they're exposed to different drugs or natural substances in the lab. So again, looking at two different pieces here, the chemotherapeutics and the natural substances, and then they test those specifically against those cancer cells. And what they've been finding is that this has been super, super effective in helping people have much greater benefits in their treatment plan. So I did create another presentation on the OncoTrace test itself, so go back and watch that if you have other questions. But we did want to give a little bit of a description or a comparison of these two different types of tests. So the OncoTrace, the primary goal of the OncoTrace is really to establish a baseline and monitor cancer activity to be able to detect and characterize the presence and behavior of those circulating tumor cells, which then gives us information on the cancer progression, the risk of recurrence, and just its current state. And then it also focuses on circulating tumor cell count, the phenotype markers, the stemness or the aggressiveness markers. And then it also is something that we'll use as a starting point and then also to monitor therapy as we go forward. So it's not really seen as much as a one-time test. The OncoTrace, as it does say trace in the name. So we're tracing what is the progression of the cancer over time. So a normal frequency of doing that test would be maybe once every 4 to 6 months, somewhere along those lines, to make sure we're moving in the right direction. The Onconomics Plus test, the goal there is to determine the most effective personalized treatment plan for each individual person for their specific cancer, right? And so the goal is to test their specific cancer cells against a wide array of potential treatment options to see what's actually going to be most effective. And so from there, what we can do is we can actually offer a much more detailed genetic, physiologic, and treatment specific analysis of where somebody's at and how their treatment plan is likely to be more effective as they move forward. So this is considered a pretty advanced tool for refining and personalized treatment protocols for people. So that way we're not guessing so much. I think that's one of the hardest things with some of the natural therapies is, there's so many things that are good for us and has been shown in studies that is effective against cancer in some capacity, but how do we know what's actually going to work for you? And so that's really what this test, where this test really shines. So how they work together. So again, we're talking about these two particular tests in general, the OncoTrace and then the Onconomics Plus. So um, there is another test called the OncoDeclare. The OncoDeclare is a test that can be used for people that don't know or don't think they have a cancer, but want to utilize it as screening. So if you want more information about that, please reach out. Or if you have a loved one that would like to know more, please reach out about that test. But so if someone has a positive OncoDeclare test, then from there we can move on to these other tests. Or if somebody already knows that they have cancer, then we can do these other tests to figure out really, hey, where is somebody at? Or perhaps you've had cancer and you want to know where you're at. Then the OncoTrace test really is that right next step. Now, so for somebody who knows that they have an active cancer, doing the OncoTrace and the Onconomics Plus together to get started with is actually a good way of going about doing it. So there's two different ways. One, we can start with just the OncoTrace and really get that good baseline and figure out, okay, how aggressive is it? How many circulating tumor cells are we seeing? Are we going to need to be aggressive or not as aggressive with somebody's current care? And then we can move on and do the Onconomics Plus after that, or we can do them side by side. And then from there, after that treatment plan is made, we can continue to utilize the OncoTrace, as I said, kind of around that every 4 to 6 month window to make sure that we're making progress that we're hoping to in in somebody's cancer treatment plan and make sure that those circulating tumor cells are going down or staying low. So there are certain medications and treatments that need to be held from anywhere from 7 to 21 days prior, and those include chemotherapies, immunotherapies, high-dose vitamin C, ozone therapy, other vitamins and nutrients that we actually are going to be trying to test to see if they're effective. If you've taken those things right before we do the testing, likely that they have been effective enough to knock down the immune response to those cancer tumor cells, and so because of that, it won't show up as being positive on the testing. And so we want to make sure that we have that window in there where, again, depending on the substance, somewhere between 7 and 21 days, um, that that washout period is there. So if you are interested in doing this testing, I encourage you, please reach out to myself, please reach out to our nurses so that way we can talk through what exactly is it that you're doing, what are you using for chemotherapy, for immunotherapy, for other supplements, medications to try to fight your cancer. We want to make sure that we have the right window of avoidance in there so that way this test can be uh, utilized to its full potential. So once we've had that conversation, then we can get you on the schedule for your lab draw. And then after that, it does take about a month to get both either the OncoTrace and or the Onconomics Plus test back. So we will want to have you on the schedule for a follow-up with me. So that way, once we get those test results back, we can go through those together. We can fine tune your treatment program. We can explain a little bit more to you exactly what your test results mean, and also help you to create that treatment plan for you that's going to be most optimal. So if you have other questions, or you want to figure out if this test is right for you or perhaps a family member, please feel free to reach out. Our phone number is 701-532-1926. Our website, valleyvitalmedicine.com. The best email address to use is frontdesk@valleyvitalmedicine. Thanks so much for joining me for this video today. I would love to have a deeper conversation with you to see if this is right for you. Please reach out, and we look forward to chatting with you soon. Have an amazing rest of your day.